Let's discuss some case reports.
We start with our first case. This was a 46-year-old male patient. He was an IT consultant, and he came to our ward sometime in the morning with severe pain in his right flank. The pain had started suddenly during the nighttime and was even getting worse over the last 40 minutes or so. He was feeling nausea too, and he had already vomited once at home, but there was no diarrhea though, and he had no fever.
So what about the clinical findings?
Our patient was basically in a normal general condition. His blood pressure was normal. He was looking a little bit pale, but the mucous membranes had a normal color. And in the palpation of his abdomen, we found no tenderness, no muscular defense, but he showed massive pain in the right flank, and this was radiating into his right groin area. And he also showed some pain when we were tapping his renal bed.
And of course, we performed
abdominal ultrasound.
So let's see what we found. We start the video clip. And
there's a kidney somewhere, the right kidney.
We see the kidney in this region, and we can easily detect this anechoic area in the region of the pelvis of the kidney, and also dilated calyces over here and over here.
And also the urethra is dilated in the region of the uretero-pelvic junction.
So we have got the diagnosis of a hydronephrosis grade 2, and there's an additional finding over here.
This is a renal cyst, a simple renal cyst, but that won't cause the patient's problems, would it, Christian?
No.
Okay, so we got the diagnosis of hydronephrosis grade 2, together with the clinical symptoms of the patient, who has got severe flank pain in the area of the right flank and radiating into the groin area. So this is suspicious, highly suspicious for urinary tract stone. And what do they do then?
So he was sent to the urologist ward, and they went for a CT to locate the stone. And I think they found one.
Yes. And the concrement of the patient was in the distal urethra, and it could be removed. So this solved the patient's problem.
So in conclusion, when we find a blockage of the urine in the kidney, a hydronephrosis, together with clinical signs, flank pain and some blood in the urine, it's highly suspicious for a urinary tract stone. And ultrasound is the best and fastest tool to make the diagnosis.
This was an extraordinary case of gallstones. So why do we show this to you in the kidney chapter? Getting curious? So let's start.
So we are concerned with a 60-year-old male patient, an innkeeper, who was diagnosed gallstones and was sent to the hospital to undergo a cholecystectomy. And the day before the operation, he was sent to the ultrasound unit to perform an abdominal scan in order to look for biliary obstruction or any signs of inflammation. This is the first video clip.
So this is a beautiful gallstone over here.
And yes, indeed, over here. Dorsal shadowing.
And as I can see now, no signs for inflammation.
A small wall of the gallbladder. So
perfect.
Only a gallstone.
But of course you performed a complete abdominal scan, didn't you?
Yes, of course. And we go on with the scan of the right kidney, and you can easily detect over here a tremendous tumor, nearly 8 centimeters in diameter, over here on the caudal pole of the right kidney.
Also over here.
Right kidney in this area.
And here we can see that also it is not echo-free, and it also has some cystic structures in it.
Correct. It's inhomogeneous cystic areas, solid areas. So I would think the diagnosis could be malignant. So the patient was sent for a contrast-enhanced examination for a CT. And the diagnosis of the CT was not 100% clear. Most likely, they diagnosed a cyst with a bleeding before, so it was not really clear. And we performed another contrast-enhanced ultrasound examination to make the diagnosis more precise.
So let's start this clip. I think you have to wind it a little bit forward until the blood flow is seen over here. Yes.
Now we see
beautiful.
perfusion of the kidney. And at the first picture, we cannot identify any vascularization, any perfusion in the tumor. But when we go on with the scan, we find
the right corner of a picture, there is a structure which has blood flow.
And there's an uptake of contrast media. So this is not only clotted blood, it's a tumor with perfusion.
At the border of this renal cyst.
And highly suspicious for a tumor, maybe a malignant tumor. So the patient had to undergo operation of the right kidney. And the diagnosis was the renal cell carcinoma, 3 centimeters in diameter, no metastasis. So the prognosis of the patient was good. To sum up, ultrasound can provide incidental findings that are very important for the patient's life. And using contrast-enhanced ultrasound, we can make even more precise diagnoses.